Good evening, everybody. Christine Barconi here in our streaming center, where we are continuing to talk about the stigma surrounding mental health and how to get rid of that in our community. We're continuing that conversation with experts from Nationwide Children's Hospital. Today was a very big day for them. Meredith is joining us. Introduce yourself and tell everybody a little bit about your role at Nationwide Children's Hospital and the new Big Lots Behavioral Health Pavilion at Nationwide Children's Hospital. Thank you for joining us, by the way.
Sure, thank you for having me. My name is Meredith Adams. I'm the clinical coordinator for the Critical Assessment and Treatment Clinic at Children's Hospital. My team has an integral role in the continuum of care. We get referrals for all children who are stepping down from our inpatient units, who have been seen in the emergency department or have called in from the crisis line, and they need follow-up care following an acute crisis situation.
And follow-up is so important after those crisis situations. We're talking about that, and that's part of what the new Behavioral Health Pavilion is going to be doing, and it's going to be doing it better than ever before. It's really a first of its kind resource that we have here in Central Ohio. Why is it so critical that we have that, and why is the continued care so important for our kids?
Continued care is so important because within those first 30 days following a suicide attempt, chances for a reattempt or readmission to the hospital are at their highest. So it's integral. It's a very important part of the service that they actually follow up, come in and meet with a counselor and work on tweaking that safety plan and address any new triggers that might have come up, or to try out any new coping skills and try to really work that plan and get to a point where they feel like they can manage that crisis.
And it's not just for the kids and the providers, right? It's really parents need to be involved in this as well. And that's something that you guys, that's a service that you guys provide, after the hospitalization, because it doesn't end there, correct?
No, not at all. A parent is a child's best advocate and a best partner in this process. Parents can become, the coach or the cheerleader who works with their child in between counseling sessions, can remind them of the different techniques that they've tried out. They can also work on putting together, gathering the support system that they have in place for their child, checking in with the child's school, with neighbors, with family members to see who may be available as a point of contact when the child needs someone to talk to. They can also be involved by gathering data and information about how the child is doing and how the interventions seem to be working, and bringing that back to therapy.
Certainly. And then, so today was a really big day for you guys. It was the grand opening of the pavilion. We live streamed it here on our NBC4i.com as well as our Facebook page. And it was just really incredible to watch. But what was it like to be there in person and knowing how big of a difference it is going to make in the lives of children and families here all over across Central Ohio and beyond, as people come here for treatment?
Oh, it was amazing to sit there, knowing that 4 years ago this began as an idea, and as a charge that was, being given to our leadership. And to sit there and the governor was present, the CEO of the hospital, a room full of people who care about kids and who care about behavioral health, and listen to the patient champion speak and tell her story was just really inspiring and makes me feel grateful that we will have these services to provide for youth.
Can you just speak to the momentous thing that this is for our community? I mean, it's nothing, we've never seen anything like this before. How is it really going to change lives and really save lives, actually?
I think what this building will offer is access. We'll have more beds, we'll have more treatment, we'll have everything will be there in the same place, so families can come in. They will have time to meet with the clinician. They'll have time to stay until they can determine a disposition in a purely behavioral health driven model. They can come back for treatment within the same building for aftercare services. It's just, I think, to know that we have this building as a staple in the community is just a really great resource.
And the building itself can really be a symbol. It's right there on the highway, very prevalent. You can see it as a like kind of like a shining beacon, that these are things that need to be talked about. Behavioral and mental health are things that need to be talked about continuously all the time, whether you're in a crisis or not.
Absolutely.
So tomorrow is the big open house, which is very exciting. Can you tell everybody a little bit about, I know we'll be there from 11 a.m. until 3 p.m. There at the hospital. Tell everybody a little bit about the building and what they can expect to see.
Sure. So tomorrow is the open house for staff and within behavioral health, and then Sunday is for the whole community.
Sunday.
That's
my
okay.
mistake.
That's all right. I didn't want everyone to show up a day early.
No, I appreciate it. I got my days all mixed up.
That's okay. What they can expect to see is a building filled with light and color. I don't know if they've announced yet who our little wooden animal sculpture will be, but it's a really,
I haven't heard.
Oh, you haven't heard?
Would you care to share?
Am I allowed to unveil?
I don't know.
I don't know if I'll get in trouble.
I'm getting ahead, yes.
We're gonna say yes. All right.
Yeah.
I'm allowed to say it's a swan, and it's beautiful. There's a swan. I think her job is to be a queen. I don't know what the meaning is behind that, but it's she has a little tiara on, and she has little ducklings on her back that she's carrying, and that to me is just a symbol of what our hospital and what our community is doing for our vulnerable patients.
I think that's really symbolic too,
Yeah.
just like the calm and the serenity that a lot of people do associate with those birds. So that's fantastic. And again, just want to remind everybody, we're here right now with Meredith Adams, who is a clinical coordinator at Nationwide Children's Hospital. We are talking about mental health in today's grand opening of the Big Lots Behavioral Health Pavilion at Nationwide Children's Hospital. It's going to be a fantastic resource for our community. And everything that they're going to do for the kids in our community to really break the stigma behind mental illness. So we really appreciate you being here. Is there anything else that you would like to add about this new facility and the treatments that you guys are going to have for our community?
Just that we're really excited to have this opportunity and have this building. So looking forward to seeing everyone this weekend.
All right, guys, thank you so much. We do want to remind everybody a little bit about the resources in our community. So I'm just going to read this to you guys. If somebody that you care about is in an emergency or life-threatening situation, please call 911 or go to an emergency department immediately. For crisis situations that are non-life-threatening, please call your county psychiatric crisis line number. In Franklin County, that phone number is 614-722-1800. That is for youth and adolescents under 17 years old. For those 18 and older, you should call 614-276-2273. If somebody you care about is having thoughts of suicide or needs to talk, encourage them to contact the National Suicide Prevention Lifeline at 1-800-273-8255. If you prefer, though, you can text the word START, S-T-A-R-T, to 741-741, where a live trained specialist will respond back to you. Again, thank you so much for being with us today. We really appreciate it. All of this information that I just shared, as well as what Meredith just shared, is on our website, nbc4i.com. There's a link in the description of this video. If you are watching on Facebook, you can click there, and you can see all the stories that we've been doing all February long leading up to the opening of the Mental Health Pavilion. Thank you guys so much for being with us today, and thank you, Meredith, and we look forward to seeing you. I'll be there on Sunday, and we will see you then.
Thank you.
You're welcome. Bye.